Welcome to the Healthy Living Series, a series of talks brought to you by the University of Alaska's Summer Sessions and Lifelong Learning in partnership with Foundation Health Partners. My name is Joan Braddock, and I will be your host for this summer series. The Healthy Living Series, in its 8th season, has been a lecture series held in person on the UAF campus in past summers. The COVID-19 pandemic and social distancing guidelines required that we rethink the format for the series this summer. We are delighted that KUAC has agreed to support this new format for the series as a weekly TV broadcast. Thank you, KUAC. Each Tuesday night for the next 9 weeks now, KUAC will air a talk by a local health expert on a range of topics affecting your health and the health of our community. We are grateful to our speakers who were willing to be incredibly flexible in adjusting to this new format, and we appreciate the time they are donating to help us all live a healthier life. Before I introduce tonight's speaker, I want to let you know that you will be able to view the talks online after they are aired by going to the UAF Summer Sessions' website at uaf.edu/summer/events. I am delighted now to introduce our speaker for this evening, Kim Huffington. Kim has been an RN for 40 years and is certified in hospice and palliative care. Kim spent the first 20 years of her nursing career working in a variety of care settings, but in 2001 she found her calling and has worked in end-of-life care since that time. Kim has most recently been the director of the Fairbanks Memorial Hospital Home and Palliative Care Services, a role she has filled since 2017. Previously, she was the manager of Fairbanks Memorial Hospital Hospice Services. Kim believes that everyone has the right to make an informed decision about their care and that advanced care planning allows us to speak when our voices are silenced because of illness or trauma. Kim will be sharing with us tonight her expertise on staying healthy as a caregiver in her talk entitled Taking Care of You, Self-Care for the Caregiver.
Hi, I'm Kim Huffington, and I'm the Director of Home and Palliative Care Services for Foundation Health Partners. I've worked with hospice since 2001 and home services for the last few years. And I've been with Foundation Health Partners since June of 2013. And today I was asked to talk about caring for yourself as a caregiver. I think it's timely topic, especially now in the pandemic that we're currently working under, that we do practice self-care. This became even more important to me earlier this year when I personally became a caregiver for my dad, who was admitted to hospice in March. And I learned then the things that I'd been teaching to families since 2001. Some were spot on, some were way off. So I'm going to share some of that wisdom with you as well. So first off, I want to start with a definition of a caregiver. And caregivers are typically unpaid family members, friends, spouse, anyone involved in assisting others with activities of daily living, providing them kind of a safety net, sometimes taking on medical tasks like providing medications, personal care, those kinds of tasks. In 2017, the Alzheimer's Association identified that there were 1.7 million Americans providing care in patients' homes for family members that were diagnosed with Alzheimer's alone. So you can imagine that number is even higher if you add in patients who are living at home with maybe MS and COPD, heart disease, those kind of debilitating chronic illnesses that need some assistance to be safe in their own homes. 6 in 10 caregivers assist with those activities of daily living that may include even injections, tube feedings, and other complex procedures that ordinarily would be provided by a medical person. So I think, as I said, the numbers are increasing, but I always say families, especially those caregivers that are caring for a loved one, they're nervous, right? It's not normal. They're not used to this. Maybe they have no medical experience, and yet now they're kind of thrust into this role as a caregiver. So many times they are scared, nervous, anxious, all of those things. I like to tell them that even though we have the medical knowledge and we can teach them, they're doing one thing that they have several things going for them, but the big things are, A, they know that person better than we do. They've lived with them many times longer, so they know their idiosyncrasies, they know their likes, dislikes, but also they're caring for them with love. And sometimes it's the love that carries us through, not necessarily the medical knowledge, right? So we've all been in those kind of uncomfortable medical situations where someone's explaining everything and we're like, I'm not even getting what you're saying. But if you can kind of bring that conversation back to how it focuses on the patient and makes a difference in their life, certainly that's what makes it worthwhile. So there's also, I talked about the millions that are caring for Alzheimer's. 61% of caregivers are still trying to work. So we call them the working caregivers. They're balancing that maybe a full-time or part-time job and caring for a loved one, and that too may be a full-time or part-time job. So they kind of have these dual responsibilities that sometimes are in conflict. So we're going to talk a little bit about some tips for balancing those roles. So 61% of caregivers are caring for someone age 50 or older. Those caregivers, 70% of them, studies have shown, suffer from work-related difficulties due to this dual role. And they average about 6.6 missed work days per year because of the conflicts that I alluded to. They average about 20 hours a week in the home caring for someone. So again, it could be a full-time, part-time job. And 58% of these care recipients, the patients receiving care, continue to live in their own home. Others maybe move in with a adult child or eventually a friend, neighbor, or an assisted living or skilled nursing facility. And 65.7 million caregivers actually make up 29% of our adult population. So it's a huge impact, and I think as we move forward, especially with this pandemic, we will, in fact, identify other issues that we didn't even think of, that home caregiving has been thrust into this limelight and now dealing with other issues we haven't identified as yet. So I think the big thing with the working caregiver, that probably the most important step, is when you identify that you're going to be caring for someone, is to talk with your employer. You know, you're going to have to be honest, and that sometimes is not an easy conversation to have, right? You don't know what your employer is going to say, if they're going to be supportive of this role or maybe not so much. So you're going to have to ask for what you need. And that's important because of the issues that you're going to face down the road. So maybe your employer would be open to flex time. You can flex your time to when your loved one maybe is usually sleeping or someone else is available to come stay with them, or telecommuting is another option sometimes, or job sharing, or just as I said, rearranging your schedule. Maybe you can work weekends instead of Monday through Friday or whatever, but it's important that you do identify how you can meet those needs and take care of your own. The biggie is, of course, taking care of your own needs. Many of us in Fairbanks fly, right? I mean, that's how we get places. And if you pay attention to those flight attendants, what do they say? Put on your own oxygen mask first. And that's the big tip with caregiving. If you don't remember anything else that I've told you, remember that you must take care of yourself prior to taking care of your loved one. If you don't take care of you, who's going to be there to care for your loved one? So you have to identify what's going to work for you to provide that self-care. Is it exercising first thing in the morning? Is it having a good book to read in a few minutes a day? Is it meditation, yoga? There's lots of options. Also, I would encourage you to reach out to a family member or a neighbor or someone who you know is going to be supportive of your new role. And again, make time for those hobbies, reading, knitting, crafts, whatever that may look like for you. And then the other important piece is to lean on others. You need to identify those key members of your support team. And as I said, could be adult children, It could be a neighbor, it could be a friend. The beauty of Fairbanks is that many times our families are outside, so it's the families we've chosen, right? Those people that after we've relocated to Fairbanks or been here and our kids have moved away, or however that looks for you, but you still have those people that are supportive of you, and that's who you need to talk to. So the other thing is sometimes we all hear, well, just let me know if there's any way I can help. Well, you need to be specific in what you're asking. Can you come and stay with Dad every Wednesday for an hour so I can go have lunch with a friend? Or I have to go to a doctor's appointment next Tuesday. Can you come over at noon? However that looks. And then talk to your provider as well for additional resources that may be available to you that in the community. Fairbanks has lots of volunteer programs, lots of support. So ask your provider or Google it what may be available to you that you hadn't thought of yet. There's home health services, obviously. I'm very familiar with home health, hospice. There's adult daycare programs. There's home respite programs through ResCare, FRA, and so there's just lots of resources available. You just have to look and ask how they can help you. The other thing that I think is important is when you get that ask, oh, just let me know if there's anything I can do. Well, instead of saying, oh yeah, I'll call or I'll let you know, create a list. And I say, make that list and just start, when something comes to you, write it down. So let's say you know that you like to grocery shop Friday mornings. So can you come stay with Dad Fridays mornings around 8 so I can go to the grocery store? I need to go to Fred's, I need to get stuff, and I need to do it every week. That's kind of my time. Or if you're not comfortable leaving someone, then say, can I give you my grocery list, or can I do pick, click, and at Safeway or Fred's, and you go pick it up and bring it to me. Jot down laundry, household tasks. Maybe they can plow snow for you. Maybe they can rake leaves. And that varies, of course, with the seasons. So identify those types of things that they can do for you that you don't always think of when somebody just asks that broad question. So like I said, errands, lawn care, and then here's the other tip. If you're like me, you make those lists, and then maybe you set it down somewhere, and then it's, oh, where did I put that list? I know I wrote it down. Where did I write it down at? So put that list somewhere where you're going to know where it's at. So stick it on your fridge with a magnet or put it by your front door. So that way when someone comes in and invariably says, oh, Kim, I wish I could help, say, well, you can. Here's the list of things that I need done. Can you help me with any of these? People want to help. They just need to know how to help you. And then the other thing that you need to do is schedule time for yourself. I alluded to that earlier. But just make sure that you know where your energy kind of starts to lag and what that looks for you. Maybe you don't need to leave the house. Maybe you need somebody to come stay with Mom while you take a nap. That's okay. Ask for that. Or maybe you're feeling really isolated, and that's pretty common these days. So just say, I need to get out of the house. I need to have something to look forward to. I need an hour a week to go have coffee with friends, lunch with friends, meet them at Pump House for a drink, whatever works for your group. Or maybe you're a member of a book club or a knitting group or something like that. So again, know that time when they meet and know that that's important to you, so you can ask for someone to come in and relieve you so you can get out of the house a little bit. There's support groups for that. There's also, sometimes churches, if church is important and you want to continue to go to your weekly service, then ask for someone to come stay with your loved one during that time. And also, churches are another great support in this area. So you can ask them if there's somebody in the church that would help you once a week or once a month, however that looks for you. So here's the other thing. If you're in this for a long haul, and I've talked with people who've cared for their loved ones I stayed with my dad for a few days, and it was the best thing I could do for my dad and my mom. It was the most rewarding thing for me, but I can't imagine doing that for months. It was for a very short, finite period in time. But I've seen caregivers that have done it for years. So sometimes along the path of that journey, you stop, you forget why you're doing this. So it's important to remember the why. Perhaps your loved one is diagnosed with Alzheimer's, which is just a slow, or dementia, slow, we call it the 36-hour day for a reason, and it's a slow process, and it can take months or years. So know that you, along the way, are going to have to remind yourself of who this person was and what they meant to you and why you're doing this. And if, while the person you're providing care for is still able, schedule some fun time for you. Maybe you always like to go for a drive on Sunday, but you need help getting your loved one into a car to go for that drive. Well, then ask for that. Hey, can you come help me get Bob into the car so we can go for a drive and see the colors in the fall, or go down, see how high the China is. Any of those kinds of things that you enjoy doing. Remind yourself of those. If you always went to the cookie jar for breakfast on Sundays, maybe the cookie jar delivers, so they bring you breakfast. So you still have that kind of little piece of normalcy. And then just try to recapture those kinds of moments. It's just, it's easy to forget when we're caught up in the act of caregiving. It becomes very task-oriented. I need to get mom up at 8, give her breakfast by 9, brush her teeth, change her clothes, get her back to bed, have her nap, get her lunch, get her back up for dinner, give her a bath, rub her back, give her meds, do all of those kinds of tasks, and then we just kind of start doing them kind of like a robot, and we forget, why am I doing this? What's the reason? For me, it was easy. I had great parents. I'm an only child. So I knew that someday when I moved up to Alaska that I may be called upon to make that long trip outside to provide that care. I just reminded myself of what a good upbringing I had and how grateful I was for that. And so as I was moving forward through that process, those kinds of things kind of kept me moving forward. And we hear the saying all the time, one day at a time. Sometimes it's 1 hour at a time, or the next 15 minutes, depending on the condition of your loved one, and continuing on, depending on your energy level. So be gentle with yourself in that. I think that's another key takeaway is if you can identify how you can treat yourself better. We always tend to put, again, our needs last, but we need to find an empathetic support group, somebody that will not necessarily sympathize or say to you, I had a nurse who said to me, and I thought, now I know why we are taught never to say this. She said, I know exactly what you're going through. My dad, blah, blah, blah. Well, she had no idea what I'm going through. She doesn't know my dad, she doesn't know me, she doesn't know our relationship. And it instantly made me kind of angry and defensive when she started saying that. So you want to look for those people that you know in your world that are empathetic. I'm in it with you. I don't know how to fix it. I don't know what to do for you, but I'm here and I'll support you. And those are the kinds of people that you want to surround yourself with during this time. And they're there. But as I said, sometimes when you're in the throes of providing care, you tend to get lost. You kind of lose yourself. So always keep yourself kind of in your mind. And during this time of social distancing, it's even more important, I think, to remind ourselves of what we need to do to kind of fill our soul and refill our energy level. So this is the part where I say, any questions? And this is the part that's really hard for me because obviously with COVID-19 and our social distancing, it's not an interactive kind of presentation. So I miss that. I miss talking with people because I always say at the beginning of my presentations, I'm here for you, you're not here for me. So I want to answer your questions or meet your needs. So having said that, when you're watching this, if something resonates with you or you need clarifying information, please know that you can call the hospice office at 458-3090 and just ask to talk to a hospice social worker or one of the nurses or just anyone. We have amazing volunteers. We have an amazing support group that can, even if you're not ready for hospice or don't want to discuss that, we can actually steer you towards some resources that will be available to you. And sometimes it's just we're having some anticipatory grief, so we might need some grief support. And we have an amazing bereavement counselor, so that's also available to you. Just reach out. Thanks so much for watching, and I hope this provided you some comfort. Take good care.